The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, and welcome to this joint LINEA and CPC Learning Network webinar. This webinar is part of a series profiling the most innovative research and practice on social norms and the prevention of all forms of violence, exploitation and abuse of children and adolescents. My name is Lottie Howard-Merrill, and I'm the Research Assistant for the Learning Initiative on Norms Exploitation and Abuse, or LINEA, which sits within the Gender Violence and Health Centre at the London School of Hygiene and Tropical Medicine. LINEA is an international and multi-pronged project looking at how social norm theory can be used to prevent the sexual exploitation and abuse of children and adolescents globally. Another aspect of LINEA's work is that we host a network of partners in research, programming, policy, advocacy and funding who are using a social norms approach to prevent sexual exploitation and abuse of young people. We're thrilled to co-host this webinar series with the Care and Protection of Children Learning Network, housed at the Mailman School of Public Health at Columbia University in New York City. The CPC Learning Network convenes academics, policymakers and practitioners to promote innovative research, nurture communities of learning and build the next generation of researchers and advocates for children and families worldwide. So today we're sharing some of LINEA's latest work in this webinar, which is entitled Preventing Sexual Exploitation of Adolescent Girls and Age-Disparate Transactional Sex in Tanzania, Feasibility Study of a Radio Drama and Curriculum Intervention for Positive Community Norm Change. So I'm really happy to introduce our presenter today, who is my LINEA colleague, Mary-Celine Shorter. She's the LINEA Research Fellow. Mary-Celine brings 14 years of experience in applied research and evaluation concerning adolescent rights and development, sexual and gender-based violence, education, economic development, humanitarian response and gender justice. She's designed, led, supervised, analysed and reported on research and evaluation and provided technical support to programmes in over 40 low and middle income and conflict-affected countries across Africa, South America, the Middle East and South Asia. So Mary-Celine's presentation will last about 40 minutes and there'll be a time for a Q&A at the end. So I'm going to hand over to her now, but in the meantime we warmly welcome you to use the chat box on your screen to enter questions for the presenter during the presentation and during the Q&A. We're hoping to have a really lively discussion after what promises to be a fascinating presentation, so I'll hand over to you now.
Thank you, Lottie, and warm greetings to all who've joined us today, and thank you for the opportunity to share with you some of our recent work. So I'm going to dive right in the interest of time. Is this, sorry, it's not moving. Oh, one second. There we go. You can see from the title slide that one of the main takeaways, just up front, I'll share with you that from the feasibility study of testing the curriculum in radio drama for a social norm change intervention that we're developing on preventing sexual exploitation of adolescent girls in age-disparate transactional sex, was that even within kind of a short period of testing of these two components, it was very interesting to see a certain enthusiasm and level of motivation for wanting to advocate for change. The LINEA team, we have Ana Maria Buller, who's the principal investigator. We have our Tanzania partners, National Institute for Medical Research, who led on the formative research, Media for Development International, who have led on the radio drama development with the LINEA team at LSHTM. And our implementing partner in Tanzania is Amani Girls Home, a wonderful CBO that we've been working with. So just quickly, why social norms? I'd like to first briefly go over a few concepts that have been key to informing the LINEA intervention that we've been developing in Tanzania on prevention of sexual exploitation of adolescent girls and age-disparate transactional sex. So why social norms? Social norms, among many factors, we recognize that social norms are not a magic bullet. There are multiple structural factors, community level factors, individual level factors, institutional level factors that converge in complex adaptive processes around the kinds of change that we want to see in behaviors and norms. So we recognize these sociocultural factors that include collective norms, and specifically those that influence adolescent development outcomes. We recognize that most public health interventions have historically worked to intervene and measure mainly at the individual level, whereas we're working to see change very much at a community-wide level as well as individual level. There was a gap identified of needing to work with social norms affecting adolescent girls' rights and healthy development, and a need to address how it is that norms are gendered in processes and outcomes. So just quickly, there's a key concept of meta-norms that work across not only reference groups, as we say in social norms theory language, within a context, but also at wider levels, even across regions or even across countries. So hierarchy, adultism, patriarchy work together, bundled together with heteronormativity to produce and reproduce conceptions of childhood and adolescence, specifically that we're focusing on, with differing gender roles and identity expectations that produce gendered structural disparities in the distribution of resources and opportunities, disadvantaging girls while reinforcing boys' perceived higher value in society. So we're really asking the questions, how is it that sexual exploitation of adolescents in transactional sex comes about? It's in context of power imbalances when adults, mostly men, abuse power and their access to resources and opportunities. Girls and often boys from marginalized, discriminated groups within a society who may be valued unequally are at higher risk of manipulation into sexual exploitation and abuse. And research often shows multiple motivations, mental and physical health risks, and consequences to involvement in transactional sex, disproportionately so for young adolescent girls. So other key concepts, adolescence, child rights, and norms, how do they come together? We're looking very much at what it means to consider norms in contexts of children's rights to participation, to freedom of expression, access to information, and that these often collide with an intensification of normative expectations around adolescence as a life cycle stage. So for example, girls in the adolescent stage are often, and even in younger childhood of course, are expected to obey adults, and especially men. Adolescent girls may be seen as lacking decision-making power at the same time that they're seeking to shape their future. We recognize adolescence as a particularly intense period of shifting social expectations for how girls or boys should or should not speak, dress, or behave. We recognize it as a period of social, emotional, cognitive, intellectual, biological development. We recognize international definitions of ages 10 to 19. This particular intervention is focusing specifically on the range of ages 13 to 15 among adolescent girls. And why age-disparate transactional sex? So transactional sex, a non-commercial, non-marital sexual relationship motivated by the implicit assumption that sex will be exchanged for material support or other benefits, is the definition that we've been working with. LINEA has defined age-disparate transactional sex as to mean men who are 10 or more years older than an adolescent girl, and greater than 18 years old. There's a current estimate in Tanzania from quantitative data that approximately 1 in 25 girls ages 13 to 17 in Tanzania have reported receiving money or goods in return for sex. This is likely to be a vast underestimate. Why target transactional sex? Within public health research, transactional sex has become an important element of inquiry due to the finding that girls and young women ages 15 to 24 in sub-Saharan Africa are 3 times more likely than boys and men to be affected by HIV and to account for 31% of new HIV infections each year in the region, according to figures from 2013. Transactional sex, we recognize, is produced and reproduced through power imbalances, gender norms, economic asymmetries, and age disparities, and constrained agency in a given context. It has been shown to contribute to gendered health inequities, and it increases, among other issues, adolescent girls' risks of early and unwanted pregnancy, low educational attainment, entrenched poverty, and other harmful development outcomes, and wide violations of their rights. From the Tanzania Violence Against Children survey, we saw that age-disparate transactional sex is also associated with sexual, physical, and emotional violence exposure among adolescent girls in particular, among girls who report receiving money or goods in return for sex, that they report higher levels of sexual, physical, and emotional violence in childhood. So some of the theories informing the intervention development concern several of these. I'm going to touch on them quickly, given the time today. We could do a whole presentation just on how theories inform the intervention. But in any case, so gender, it concerns the social construction of gendered identities and the ways in which diverse gendered identities, multiple masculinities and femininities, and lived experiences are produced and reproduced intersectionally through multiple overlapping forms of discrimination and inequitable gendered power relations. Gender theories attend to the differences in processes concerning access to and control over resources, opportunities, decision-making power, and agency in constrained contexts, and structural inequalities that are also produced and reproduced through inequitable gender relations. Theories of power recognize that power is not only unidirectional or exercised as, quote, power over, unquote, but it's multidirectional, dynamic, and constantly being negotiated and renegotiated. Bringing together theories of gender and power with social norms, we recognize that all social norms are gendered in processes and outcomes within and across what are called reference groups in social norms theory of people who influence each other's attitudes and behaviors, and social expectations for each other's behaviors. Social norms are produced and reproduced through gendered power relations, and that, like gendered identities and inequities, gendered norms are constantly subject to processes of contestation, renegotiation, and change, opening up creative possibilities for resisting inequitable norms and promoting new gender equitable norms to end harmful practices such as exploitation, sexual exploitation in age disparate transactional sex. So additionally, we also worked with concepts of critical consciousness and transformative learning. The curriculum and radio drama sessions were designed and structured not with a didactic approach, but one informed by theories of critical consciousness raising and transformative learning. Facilitators used approaches based on asking open questions, guiding discussions, not simply transmitting messages and checking if participants had internalized them, but rather guiding a process of reflective dialogue and group deliberation on values, norms, and how new positive norms may come into influence across peer reference groups and at community level. And finally, for the feasibility study, a theory that informed the methodology itself was a person-based approach, and this was to ground the social norm change intervention development process within a sensitive awareness of the perspectives and lives of people who will engage with the curriculum in radio drama, particularly using iterative qualitative methods. So the intervention development process is informed by several stages, and it's rare that we have an opportunity to kind of go within the black box of intervention development and conduct an iterative process and be able to share the results of that process with you. So it's wonderful to be able to talk with you today about this. So before the feasibility study of the draft curriculum in radio drama, starting in 2015, LINEA conducted formative research with adolescent girls and boys, adult men and women in Tanzania and Uganda in partnership in Tanzania with the National Institute for Medical Research. Since the data collection, primary and secondary analyses, including social norms analyses, have resulted in several papers, some of which are published and some of which are forthcoming. We have a resources section at the end of the presentation. We also conducted a mapping of relevant programs from local partners and a mapping of child protection mechanisms, services, and community-based resources. So the intervention development process has very much been a process of collaborative co-design, building on the formative research, building on literature on social norms, learning from other interventions. It's been a process of co-creation of materials with local partners and community members for the curriculum in radio drama. And then once we had a draft of the curriculum in radio drama, we carried out data collection for the feasibility study in June and through August 2018 to look into the acceptability and relevance of the intervention within a peri-urban context in northwestern Tanzania. So next steps from the feasibility study we'll share with you a little bit later, but will entail more co-design process to refine the curriculum in radio drama before going to a full pilot trial. So this diagram shows you kind of how the different pieces of evidence fit in to inform the intervention development and how co-design and research evidence are being integrated. So a systematic review, just quickly, that the LINEA team has also conducted identified some key social norms perpetuating sexual exploitation and abuse of children and adolescents, such as expectations of sex in exchange for good and favors, and, for example, expectations of financial contributions to the household, and ways in which beliefs that underpin sexual exploitation of adolescents underpin as well the practice of age-disparate transactional sex, such as a belief that girls upon puberty are suddenly ready for sex, emotionally, socially, physically, etc., economically, which may absolutely not be true. Men are entitled to sex at all times, whenever they want it, and a belief that age-disparate relationships can be beneficial, which sometimes ties to a social norm around kind of tacitly looking the other way or condoning the practice of age-disparate transactional sex if it results in financial contributions to the household. So the next step was formative research. The formative research sought to understand the emic perspectives, or how women, girls, boys, men understood within northwestern Tanzanian communities of data collection. How did they see sexual exploitation of adolescent girls? What are the important issues that they saw affecting sexual exploitation of adolescents? What ways did they see to prevent sexual exploitation of adolescents? And some key social norms, such as economic provision being central in sexual and romantic relationships, or the ways in which fundamentally men, women, girls, and boys are valued differently within a society, very much underpin the practice of age-disparate transactional sex. So also through the analyses of the formative research using social norms theory, we also identified key reference groups for each social norm and considered the nature of what we call positive or negative sanctions for both norm enforcers and norm targets. So those who enforce a social expectation and those whose behavior is supposed to conform with that expectation. So moving on from the formative research, the co-design steps have involved design workshops, careful translation and translation corrections of the materials, training of trainers. We also consider the community feasibility study to be part of the co-design process. That co-design is with partners, but it's also very much with community members. So co-design principles that we're building on include working with partners and communities' strength and resilience, not going in with a name, shame, and blame approach, but building on strengths and positive values that already exist within the community, engaging many parts of the community, enabling agency and voices of those rarely consulted or heard, fostering a collective sense of responsibility for child rights, adolescent rights, for prevention of sexual exploitation of adolescents, and child protection. And also these co-design steps are essential for avoiding, in research terms, what may be termed as a null trial or an impact evaluation for the later full implementation, at the risk that it might show no results for reducing sexual exploitation of adolescent girls if we don't test the intervention components beforehand. So one of the outcomes of the co-design workshop was developing an overarching intervention theory of norm change that draws on relevant norm change interventions for preventing violence against women and girls. This outlines how LINEA envisions norms shifting through working within and across reference groups that are relevant to and influential over the problem of how to prevent sexual exploitation of adolescents in transactional sex with older men. The change process is imagined to be nonlinear and dynamic, with multiple loops and concurrent possible norm change cycles happening simultaneously and differently within specific reference groups, for example, girls versus men. The intervention strategy prioritizes fostering and modeling positive new norms that reject age-disparate transactional sex, while critically promoting adolescent girls' healthy development, rights, positive masculinities, and gender equity. We next conducted the feasibility study of the curriculum in radio drama to assess the case for plausibility, acceptability, and contextual and cultural relevance of the intervention, and for the importance of a subsequent full pilot trial. Transparency about the process of intervention development before a full trial is a contribution where this phase has otherwise often been, as I mentioned before, a black box, rarely presented or carefully documented. A feasibility study helps to address the potential for research and resource waste from doing a full pilot trial with intervention components of feasibility as yet untested, and provides transparent reporting of both successes and failures in areas for improvement. The feasibility study methodology also draws on guidance provided by O'Caffein and co-authors from 2015 from an article titled Maximizing the Impact of Qualitative Research in Feasibility Studies for Randomized Controlled Trials, Guidance for Researchers. So key objectives of the feasibility study, we really wanted to explore any uncertainties that the future pilot trial should take into account, such as the community acceptance and relevance and perceived benefits of the components, also their implementation and issues that might arise in the delivery of these components, as well as how to go about planning a future pilot trial. So critical questions, are the curriculum and radio drama content of the right technical depth on masculinities and engaging men for gender equity in adolescent development? What's needed to ensure not just a do no harm approach, but a developmentally supportive and rights-based approach with adolescent girls? And how likely is it that the theory of change might serve as an explanatory model of pathways to intervention outcomes for adolescent sexual reproductive health and rights and reducing age-disparate transactional sex? So feasibility study methods. So development of a complex intervention such as this one with multiple interacting components is something that requires qualitative feasibility testing, particularly given the sensitive topics of men sexually exploiting young adolescent girls in transactional sex. So feasibility research that's qualitative allows intervention development teams to observe real-life contexts of the intervention development, of the intended intervention, and to engage in action research where potential participants and facilitators or future implementers are actively involved to ensure what we call a good intervention context fit. Co-design and feasibility testing requires qualitative methods, and these have allowed the study teams to identify norm change pathways that may be strategic for preventing sexual exploitation of adolescents and promoting new norms of healthy positive masculinities in adolescent development. So methods such as drawing, storytelling, role plays, games have particularly helped engage participants with literacy limitations, for example, and also younger adolescent girls. Qualitative methods have further proved useful in exploring the potential of group reflection processes for aligning social norms with human and child rights in the case of age-disparate transactional sex, specifically the rights to bodily integrity, freedom of expression, access to information, to freedom from violence, and to participation in decisions that affect girls' own body, time, health, and future life options. So qualitative and participatory methods were further key for surfacing tacit and normalized everyday views. They supported the focus on building dialogue around community resilience, hope, identifying positive alternatives. So ethics and safety protocol development, I worked on in the team to develop a synthesis between World Health Organization guidance on intimate partner violence, researching violence against women and women's health and sex trafficking, combined with multiple sources of guidance on researching sensitive issues with children, specifically sexual violence. We worked with Amani Girls Home to understand and work with and in some ways further capacity develop their reporting, referral, tracking, and response system through an established referral network. And in February 2018, the London School of Hygiene and Tropical Medicine Observational Research Ethics Committee approved our ethics protocol, and then in May 2018, the National Institute for Medical Research in Tanzania also approved the protocol. Ethics and safety training, I'm just going to quickly show you this slide. We can talk a little bit more about it later in the Q&A. Feasibility study components. The study was a condensed version, shortened version of the full intervention. We looked at the ways in which the key storylines, the principles of the curriculum and radio drama did or may not have followed the theory of change in reflecting on community values, human and child rights, how girls and boys are valued in the community, the benefits to living without transactional sex that's age disparate, and how everyone in the community has a role to play in preventing it and promoting positive norms of girls' healthy development and positive healthy masculinities that respect and uphold girls' rights to development and a healthy transition to adulthood. So the target populations for the radio drama were listener groups structured with 14 girls, 11 men, 12 women, and then we also conducted separately a few focus groups with additional 8 women, 8 men, and community leaders. And then we also conducted structured observation of the curriculum sessions. The groups were, the girls group was 15 girls. We had 7 couples for a total of 14 when we had mixed sex sessions, and then we also conducted in-depth individual interviews before and after the curriculum sessions with 3 girls, 3 men, and 3 women. Participants were recruited using purposive qualitative sampling, and inclusion criteria included age for girls, 13 to 15 years, being in a couple with an adolescent daughter and being a primary caregiver of an adolescent daughter for the adult women and men, the location of residence being near the study site, and then being available for the activities. Community agents of Amani Girls Home recruited participants. Amani Girls Home facilitators moderated the sessions. All sessions and all data collection were conducted in Kiswahili, and group activities lasted for about 2 hours. Data collection, analysis, and reporting of the findings followed a thematic and theory-driven analytical approach for analyzing the data from the structured observations, the individual interviews, and the session notes. So the study identified a range of participant perspectives given the qualitative sampling approach on the curriculum in radio drama, as well as on gender relations, social norms, and personal agency affecting how to prevent age disparate transactional sex. So areas of success, adherence, meaning how often people attended the sessions, was excellent. There was no more than 1 participant absent from any session. This might be because we conducted the data collection during the dry season, meaning that particularly the adults may have had more time to attend sessions. Areas for improvement going forward would be that we would recommend keeping the women and the men in separate single-sex groups to enable richer and more candid discussion. One of the questions that we have ongoing was how can we ensure that the recruitment of the participants reflect existing reference groups, and how to reach the most influential among those in the groups who influence the practice of age disparate transactional sex. So onward to some of the adolescent girls' views. Girls overall, they were able to identify several negative consequences of transactional sex. They knew very well what the risks were. They discussed issues of power and agency in making decisions, and had in many moments kind of emphatically emphasized, we as girls, we have power within to make decisions, whereas adults in the context, particularly men, seem to sort of reiterate a discourse around girls have no power, girls can't make decisions. So girls were resisting that already within the few curriculum sessions. Girls absolutely recognize the importance of income generation activities and economic alternatives to transactional sex, and also education. And both women and girls lamented the issue of accessing resources having to go through men. Going forward, one of the issues around discourses that emerged from the sessions with girls was that girls often use the phrase that we must resist temptation, and in the future the curriculum revision will address how to manage when victim blaming attitudes come up within the group, and how they can be further unpacked within further iterations of the curriculum. So one of the quotes from a girl was, adolescent girls should use their power to address challenges. If they earn money, it will not be easy for them to be tempted. So some of the women's reflections, women clearly understood that gender and power as theories raised in the curriculum were not just theories, but lived realities in their day-to-day life and in their memories of being an adolescent girl. They could clearly relate these theories to their own experience, and specifically to the issue of transactional sex. Notably, many women expressed impatience about wanting to take action and wanting more tips and assistance from facilitators about how to lead dialogues in their families and communities. And so we're going to take this expressed incredible motivation from women into account in the future iterations of the curriculum to include more reflection and action sessions and take-home exercises throughout rather than sort of waiting until the end of the curriculum. So men engaged very much with the idea of adolescence as a distinct life cycle stage, remembering their own adolescence. At the same time, going forward in the curriculum, men need to recognize power dynamics between men and girls and also avoid victim-blaming attitudes and replace them with positive recognition of girls' power to and right to participate in decisions, for example, over consent, sexual consent. So confirms, the findings also confirm the belief that among the facilitators of Amani Girls Home that the curriculum will positively engage rather than ostracize men, and this was a key aim of the curriculum development process. Through the sessions, we recognized also that men increasingly began to make statements that show that they recognize that there are both benefits to changing their behavior and that they need to change their behavior for girls' health and development. And some of the men felt like the session content was directly targeted at them. Insights for curriculum refinement: we need to unpack norms underpinning men's control over resources and build critical consciousness over how men can share power and control over resources with women and girls. We need to further unpack norms around men's hypersexuality. We need to work through the sessions on men and girls' own understandings of consent, and particularly continuous consent, and build their knowledge of and expectations for continuous consent and girls' right to refuse sex without retaliation. And to further develop the take-home exercises to diffuse new knowledge and normative expectations in the community. So I'm going to have to rush a little bit, but going through the radio drama results, again, participants were qualitatively purposively sampled according to gender, age range, 13 to 15 for girls, and with adults who are primary caregivers of an adolescent daughter. We conducted qualitative methods of structured observation. We also conducted separate focus group discussions immediately after listening to all 15 sessions. Sessions lasted for about 2 hours. Analysis and reporting also followed thematic and theory-driven analyses of the notes and observation forms. So the radio drama. So we had Bahati and Chacha. Bahati was an adolescent girl, and Chacha was a boda boda, or a motor taxi driver in his early 20s. And the characters in the storylines illustrated the problem of age-disparate transactional sex through a boda boda driver offering lifts to schoolgirls to cover long distances to and from school and expecting sex in return for favor. Designing the radio drama, we used Ben Chislaki and Lori Heisey's social norms flower as a framework that enables consideration of various domains, institutional, social, individual, etc., which influence individuals' actions, and recognizing that social norms operate at the intersection of these domains. So using this framework to design the radio drama meant that the storylines and characters don't operate in a vacuum. None of the characters are all good or all bad. No, all baddies are goodies. This made the story more realistic and the characters complex and therefore relatable. Additionally, it's allowed listeners to identify the various factors that cause people to participate in transactional sex. For example, they were able to identify challenges in the adolescent girl Bahati's life. Like, for example, her mother doesn't value her right to education. Also, her mother is pressuring her to contribute to family income because of other household pressures and issues with her father's livelihood. And the distance to school being long and the family's lack of money for transportation costs, as well as the pressure to help with household chores and Bahati's, therefore, time pressure between school and expectations for household work at home. So we also made sure that the radio drama drew on another element of social norms theory, considering the role of reference groups, and that reference groups positively and negatively influence or sanction the characters. For example, the boda boda drivers laugh and joke, encouraging each other to pursue young girls. However, one of them, Bernard, warns Chacha of the negative impacts of transactional sex and begins to dialogue with him about positive alternatives. Another example is Bahati's friend Modesta presents a positive alternative to girls participating in transactional sex. And Modesta's encouragement that Bahati refuse lifts with Cha-Cha and telling Cha-Cha to leave Bahati alone could have a preventative and protective effect. So the point was in the radio drama to try to model positive alternatives to harmful behaviors. And it was interesting that among the characters, those characters who did model positive alternatives to harmful behavior were the most popular among the listeners. And this is something that we will definitely further focus on in the radio drama. So the radio drama listener groups seemed to, from what participants said, was that they definitely see it as highly acceptable and relevant. They felt that it sounded very realistic, that it was easy to follow. It was encouraging them to consider ways to change their behavior. Participants recognized the ways in which the Boda Boda driver was manipulating Amali with his power and resources. And they liked ways in which active bystander behavior from positive men are examples of masculinities. For example, there was a teacher who confronted another teacher who was exploiting one of his girl students sexually, that the listeners really liked that there was a positive example of a healthy masculinity challenging what they saw to be a negative or unhealthy masculinity in the exploitative teacher character. These are examples of drawings. I mentioned that we use participatory methods. Drawing was one of them. We worked with the Amani Girls Home worked with the participants in the radio drama groups to depict how they saw the characters. This is Cha-Cha and Bahati. Listener perspectives around the themes of listener enjoyment, concerns, recommendations. So based on the listener groups and the focus groups, the radio drama characters really reflected the lived realities of the listeners in the area in northwestern Tanzania. They felt like the sound effects and actors sounded like they were from the very district itself where we collected data. There were some casting issues. Some of the characters portraying girls didn't sound realistic enough, but generally the listeners found the radio drama engaging and they wanted to continue listening to it. So indications of influence on radio drama listeners based on the data. So results from the feasibility showed that the radio drama actually led within a relatively short period of time to participants starting to reflect on their family and community values. They started to build knowledge and skills and begin to create new norms and alternative futures. Many of them wanting to leap ahead to the stage of, in the theory of change, of making commitments and taking action. Different demographics of listeners felt that the radio drama was targeting them. Adults, mothers, fathers, they felt that the radio drama was about parenting. Adolescent girls felt that it was about encouraging them to resist transactional sex. Men found it educational, that it helped them reflect on their role in age-disparate transactional sex relationships. And women were considering how they, as mothers, might be able to change their own behaviors and become closer to and more supportive of their children, specifically adolescent girls. So insights from the radio drama will help us refine the drama in the next episodes. So we need more varied and aspirational, positive, kind of gender equitable men characters, depicting positive masculinities. We need to sensitively show consequences, health, physical, mental health, social consequences, economic consequences for men who engage in age-disparate transactional sex. And with girls and men, continue to model how peers can support each other in reference groups to positively change their expectations for each other's behavior. Other insights, we need to, in future radio drama episodes, continue to expose how power inequalities increase girls' risks of coercion and forced sex. We need also to demonstrate through the characters, particularly girls, how they can support each other as peers, and how mothers and fathers can also support their adolescent girls within a context of increasing kind of safe, supportive, and nurturing relationships, which is identified in the INSPIRE strategies, the 7 strategies for reducing violence against children, as bringing about protective factors for ending violence against children, including sexual violence. So some overall insights, ultimately fostering and promoting new positive norms to transform the practice of sexual exploitation of adolescent girls and age-disparate transactional sex requires not just incremental individual level change, but fundamental and community level change. And as changes must be fundamental in order to bring about transformative outcomes, challenges in implementation may be anticipated, and feasibility study results help to mitigate these challenges. So some of the limitations: the small qualitative samples may not have reached saturation in views of adolescent girls, women, and men across the feasibility site district. It's possible that the formats and the methods of focus groups, listener groups, non-participant observation could tend toward consensus and mask dissenting views, foreclosing debate and risking premature conclusions. Other limitations are that the study, the intervention as it continues to develop, needs to consider ways in which to work with adolescent boys, considering how they are part of the community and very influenced by fathers and older men's behaviors, as well as critically the issue of economic alternatives to transactional sex for adolescent girls. There needs to be consideration of a structural intervention that could be added to address girls' constrained and unequal access to economic resources and opportunities. So next steps in the short term, we're working right now actively to incorporate feedback from the feasibility test and finalize the curriculum in radio drama. We're looking ahead toward the mid and long term of the full pilot trial aimed for 2020 and 2021. The final intervention will have 39 radio drama episodes and probably a similar number of curriculum sessions to be implemented over a period of 9 to 12 months. The next step is really to continue incorporating what we've learned from this feasibility study. Some of this learning has been detailed in the presentation today, so you have an idea of some of the things we're thinking about changing. Ultimately, we also aim for this intervention and its pilot trial to help generate learning and evidence that could help inform the Tanzanian National Action Plan to end violence against women and children. And this seems like a great national platform within which to, to contribute to, and from which the LINEA evidence may also inform future intervention, development, and evaluation. So just a couple of key questions that we have coming out of the feasibility study to inform development of a pilot trial protocol. You have some of the questions here. What effect does the intervention have on adolescent sexual reproductive health and rights outcomes, including violence exposure? What's the added value of the curriculum to community level broadcast of the radio drama? How can innovations in norms measurement that we may develop around transactional sex, age-disparate transactional sex might inform future evaluations? How can we learn from process evaluation to improve the subcomponents for diverse groups of participants? And what guidance might we be able to give through an impact and process evaluation of a future trial that can help optimize replicability and scaling up of the intervention? Here are some of the resources mentioned in the presentation. So thank you, and we warmly welcome your questions.
Brilliant. Thank you so much, Marie-Céline. It's amazing how much you managed to get through in that short time. Oh, let me just, yeah, there we go. So we have a number of questions coming in already. The first one is from Jian, and it's about the issue of safeguarding. And so I'll just read the question to you, and I think you've kind of touched on it, but you can expand. So it says, I see that the presentation is mainly concerning social norms, but I feel that the legal framework and intervention is also equally important, as it's an important part of child safeguarding. So what is the status and effect of the legal framework and its linkage on the issue of preventing violence against and exploitation of children and adolescent boys and girls? So maybe you can, expand on that.
Sure, thank you for your question. It's a very important one. So we are currently in a process of adding to what we've already collected to understand what the legal framework is within Tanzania. Of course, the intervention is guided by international child rights, at the same time as we are very well aware of specific legislation within Tanzania and specific constitutional law that governs issues of sexual offenses against children under the age of 18. So basically, in Tanzanian law, all sex with anyone under the age of 18 is statutory rape. So this is an issue that we will be grappling with, figuring out how to lead dialogues through the curriculum, in particular, through the intervention, raising people's awareness. I think many people are very unaware of the laws around statutory rape. However, there have been some media reports of an increasing, since Magufuli became head of state, there's been an increase in focusing on legal punishment increases around that the prison sentence can be up to 30 years for what is legally defined as statutory rape. So we're consulting with a lawyer, and we'll continue to further flesh out how the curriculum will try to incorporate and engage participants in discussion around the legal context within context of also rights and norms, and how can all of these laws and rights and norms be aligned. That will be a long-term process, and it's one that hopefully the ways in which this intervention will contribute to implementation and monitoring of the Tanzanian National Plan of Action to reduce violence against children, women and children, hopefully will inform, and advocacy at country level is something that we're already in conversations about how to plan for and equip with evidence for policy discussions. Thank you for your question, and please stay tuned for more on the legal framework side. You also mentioned safeguarding. I don't know if you also wanted to understand a little bit more about child protection. So of course we both have to work legally within the government child protection mechanism, working with the district level social welfare officers and community development officers. However, we always work very carefully to map available formal and informal resources, such as medical or health resources, legal aid, psychosocial services, safe houses, helplines that may come from the government, but that also may come from NGOs, large and small, and grassroots groups and community-based groups, to put together a comprehensive child protection referral, reporting, referral, tracking, and response system, as well as extensive training of Amani Girls Home staff on the topics that I mentioned, which might be worth kind of covering a little bit here quickly, if I can find them, on gender violence and rights, on how to manage privacy and confidentiality in discussing or conducting data collection around sensitive issues such as sexual exploitation and sexual violence with girls or anyone under the age of 18, also with adults, on issues of what kinds of steps a facilitator or a data collector or child protection officer should take when a child discloses that they've been exposed, or someone they know has been exposed to sexual exploitation and abuse or different forms of violence, including psychological first aid, what kind of healing statements, I believe you, this is not your fault, nobody deserves this, understanding their role, how each person needs to understand their role, and not expect a child to tell them all the details of what they've been through if they are not a formal investigator or a psychosocial counselor who will be able to support them in a more ongoing way. That's a short version. Of course, there are many other aspects of ethics and safety, protocol development, implementation, training. Yeah, and unless if you have further questions about more details about that, we might move to the next question at this point.
Wonderful, thank you. So we've got, I'm going to go to some questions which are specifically, would you mind, I can hear some feedback, sorry. Can you unplug that speaker? Thank you. Sorry. I'm going to go straight to some questions about the intervention itself. I'm going to kind of group them together if that's okay. We've got some about the radio drama. How did we settle on the number of episodes? And also they were wanting, this is from Navad, and they're also asking about the time it's taken from the research to the actual episodes coming out. Navad has also asked about we've talked a lot about the co-design process, and they would like you to expand more about what the co-design looks like, and just to expand on that a bit more. Can I ask another one as well?
Sorry, so yeah.
We've got about the episodes, the number of episodes, and the lag time. We've got the wanting to substantiate on the process involved in co-design. And then Clara has asked some questions about whether both girls and boys participated in the curriculum, and how the curriculum and radio drama components interact with each other. I think, because we're short on time, we'll stick to them. Yeah.
Can you hear me? Okay, thank you for your questions. They're all really rich questions, and I'll do my best. I don't know if we'll have time to get through all of them in our remaining 7 minutes. The number of episodes of the radio drama scenes, we developed an initial 15 to try to give enough length and of each scene, which ran about 15 minutes each scene, to start to develop characters and storylines. Fundamentally, it was our radio drama media partner, Media for Development International, that recommended that we start with an initial tranche of 15 to start to really develop the story, and then test those before continuing. The timeline has been, we identified our local partners in 2017 following the formative research, and then immediately in August of 2017 we conducted, and this relates to co-design, one of the first design workshops for the theory of change, the curriculum, and the radio drama. Of course, co-design didn't start with that design workshop. It started back in 2015, engaging our Tanzanian research colleagues at the National Institute for Medical Research, and numerous, Lottie, do you remember the total sample size from the formative research? We had like, it depended on the group, but we had, we had at least around, I think it was 20 girls, 20 men, 20 women, 20 boys for in-depth individual interviews, and then an additional sample for focus groups within the formative research in districts of northwestern Tanzania that would be similar to the sites of data collection for the feasibility study. So co-design really started with the formative research and has been continuing throughout. Maybe I can go back to, I don't know if I can go back to the presentation. Anyway, if you remember the hexagon diagram that showed all the different ways in which we're working to integrate research evidence with co-design processes, recognizing that our multiple partners and the multiple community members and leaders that we've consulted all throughout processes of formative research, of the design workshops we've been conducting. We've already conducted 2 and we're about to conduct a 3rd. And then the feasibility study with the additional sample of community members who have participated, recognizing the emic perspectives, the ways in which transactional sex and sexual exploitation are viewed from within the context, recognizing that community members and leaders are experts by experience, and that we need to very carefully knit together what we have been learning from the research evidence with what a range of people across ages within the context are telling us about the practice. So it's been an iterative process that is in its 2015, 16, 17, 18, 19, in its 5th year of co-design. I actually had a couple of slides on co-design principles Yeah, I can share a little bit more with you afterward, but the idea of using multiple methods with multiple partners and multiple moments and ways of engaging to help inform the content, the structure, the processes of these intervention components, the curriculum and radio drama. There was a question about how the curriculum and radio drama have been knit together. It's really in part, again, going back to the formative research, both the curriculum and radio drama are intensely informed by the findings of the formative research interviews in the same areas we conducted the feasibility study. And we are working, the ways in which they're knit together certainly functions at the level of theory, considering gender, intersectionality, power, critical consciousness building, transformative learning, etc. That we're working going forward in the second iteration, because right now we're taking the results of the feasibility study and informing the next iteration of the curriculum and radio drama and finding ways in which they can be knit together. It is possible that we might convert some of the storylines into case study stories that would be discussed within the curriculum. So that would be one practical way in which they might be actually knit together beyond the conceptual and theoretical and content-based ways that they've been knit together. But content-wise, the curriculum and radio drama content and structure are very driven already by the formative research and the design workshops and the feasibility test results in an iterative process over the past 4+ years. So,
great.
Thank you so much. We're running really short on time, so what I'm going to say is that we're going to we've recorded this webinar and we'll be posting on our YouTube channel, and you can always get in touch with us by emailing LINEA, which is LINEA @lshtm.ac.uk, and I'll forward on the questions to people. I'd just like to end with a bang. One more question. So Amy has asked if we have any thoughts about how we might apply this in a fragile context. So I'll leave you with that, and then we can wrap up. And
thank you. I think that that's an incredibly important question. Having worked in fragile contexts myself, I'll just share a quick story with you. After conducting research, qualitative research with Somali refugee adolescent girls in 2012, I made an explicit decision to try to work within a calmer context, to first try to find ways to address the ways in which norms and other social and economic factors drive transactional sex between older men and young adolescent girls. We need, as a field, as a nascent field in many ways, applying norm change approaches to preventing transactional sex and sexual exploitation of adolescents and children. We have a lot of work to do to work with partners and communities and within our own teams to advance what we call a do no harm approach. I would say that the LINEA intervention approach is looking to go beyond the do no harm approach. It's looking to understand a little bit better how to design a program to prevent sexual exploitation of adolescent girls before it may be adapted for fragile contexts. The problem with fragile contexts, of course, is that systems and resources are not only weak or limited, but can be profoundly broken, including any protective community or family factors and mechanisms. And personally, I have observed a high degree, obviously, of corruption in the ways in which institutional actors, state actors even, or interstate or multi-state actors within a fragile state context may be actively involved in sexual exploitation and abuse of adolescent girls or adolescents and children. So I think that that's an open question for all of us to keep thinking about. Right now, we're working in northwestern Tanzania. Stay tuned. LINEA in the future does intend to learn from this initial program model that we'll be developing, finalizing the development of and conducting an impact and process evaluation of before LINEA will potentially later consider working in conflict-affected or fragile state contexts. Thank you so much for such an important question.
Okay, thank you so much everyone for all your attendance and for your questions. Like I said earlier, you can contact us here at LINEA at linea@lshtm.ac.uk, and I posted that in the chat box. And I've also posted the link to where the YouTube recordings will be. But you can find us on the internet and where you also got this webinar mailing from. So thanks again. We've got one more webinar coming in the LINEA and CPC Learning Network webinar series. So stay tuned for more news about that. But until then, thanks again and